Don't drink that bleach. Apparently, hundreds of people had the presence of mind to at least first call the state of Maryland's emergency hotline to ask if it was all right to ingest Clorox or other cleaning products to stave off COVID-19 before actually doing so. In Maryland's case, the Republican governor went on ABC's This Week to just say no to ingesting or injecting disinfectants. Hi, I'm Amy Grant of the ABL organization. COVID's been really tough on first responders globally. In early March, when the virus first crept into Denmark, calls to Copenhagen's EMS doubled to 2,000 a day. To handle the overload, they opened a second call center to try to allay fears and dispatch ambulances. Fortunately, it didn't take them long to realize they needed responses to FAQs and a way to triage the patients who needed help now. Meanwhile, a year earlier, Microsoft Azure had already developed a healthcare bot that blended AI with natural language processing to help organizations support virtual health assistant scenarios. So, working with Microsoft's bot team, Copenhagen installed its COVID-19 bot in mid-March, responding to 30,000 calls on its day one. Soon after, it was rolled out nationwide. Other countries using the bot include Italy, which today uses it to standardize the dissemination of COVID-19 information, but has plans to use it to help manage patients' chronic conditions. In Finland, within a matter of weeks, they co-developed the Corona bot with mental health professionals to query the 73,000 patients who used it about their symptoms in Finnish, English, Somali, Arabic, and Russian, responding with info on whether or where to seek treatment. They also provide content and exercises to help manage anxiety. In Israel, in less than a day, the largest acute care facility in the country created Cori, its COVID bot, and within weeks served over 30,000 people. In the United States, one of the first companies to create a health-focused chatbot was Andrew Lee's Bowie Health, which announced its symptom checker in early February. Funded with $29 million, the AI bot was originally designed to help patients self-diagnose and triage to their appropriate care site, with everything you need to know about every symptom A to Z. It's now the go-to site for Massachusetts residents concerned they may have COVID. Like Bowie, Providence Health was in the process of developing a general-purpose health bot when along came COVID. So, working with Microsoft in early March, Providence repurposed their chatbot, Grace, to deal with COVID system-wide. Grace quickly began handling over 150,000 messages a day, primarily from those who were concerned they might have COVID and would otherwise probably have shown up in their doctor's offices or their hospitals. Based on the patient's responses to Grace's questions on their coronavirus assessment tool, she can also direct patients to a $49 telehealth visit to allow for a closer examination. Besides being deployed by hospitals, about a month ago, the CDC Foundation announced the creation of Clara, the coronavirus self-checker, who, like her sister Grace, is focused on minimizing the number of patients who have cold or flu-like symptoms from accessing limited medical resources. In all, within just a few months, Microsoft has deployed 1,230 instances of COVID-19 bots to 18 million individual users and served up 160 million messages. The most recent entrant into the COVID-19 family of chatbots is the COVID-19 plasma bot. Just announced last week, the bot was created in tandem with the COVID-19 Plasma Alliance, a group of scientists, pharma companies, and other stakeholders looking to recruit donations for plasma research. The idea behind the site is that with nearly 3 million COVID cases worldwide, hopefully there will soon be 2.8 million COVID survivors with antibodies in their convalescent plasma to help fight the virus. The Alliance aims to recruit survivors to donate their plasma so they can make a potential treatment called polyclonal hyperimmune globulin, HIG, which ultimately will concentrate the antibodies into a medicine. The bot serves as a platform for COVID survivors to identify if they qualify, not everyone does, and where to donate their plasma. Then the clinical testing will begin, and once it's determined that the HIG treatment is safe and effective, it will be presented to the FDA for approval, then manufactured to scale as a treatment to be used in hospitals globally. Both the CDC and the UK's Blood and Transplant Organization are actively encouraging COVID survivors to donate their plasma. With time being of the essence, this is the time for survivors to become a global hero network in the war against COVID-19, as only they can, with the assistance of a few bots.